The symptoms and causes of colic. An old-fashioned way of diagnosing colic used to be purple crying, where if your baby cried for 3 hours a day, for 3 days, a week, for 3 weeks, then the diagnosis would be colic. However, we've discovered that colicky babies don't necessarily cry for hours at a time. If crying is a common circumstance, babies with colic tend to scrunch up their legs, clench their little fists, and go red in the face and sometimes even purple in the face. More commonly, colicky babies are always wriggling and squirming and grunting. And they never seem to be really comfortable even when they're sleeping. They'll often stir and give a random scream of discomfort and then doze off again. They don't appear to sleep peacefully as babies should. Their little tummies are often firm and bloated, and they tend to pass a lot of smelly wind even in their sleep. Whilst attempting to get rid of the unwanted gas, they'll often arch their backs and extend their legs to ease their discomfort. They are exhibiting plenty of unsettled baby behaviour and often have difficulty in establishing a feeding and sleeping routine. And that usually makes them generally unhappy. Often mums will fall into the trap of overfeeding their babies to placate them, which seems at the time to be the right thing to do. This can worsen the problem because it places even more strain on an already overloaded digestive system. When babies are born, they don't have digestive bacteria, and their digestive systems develop over time. This isn't usually a problem in the first few weeks because their tummies are so tiny and the feeds are small. However, as they grow and feed sizes increase, their digestive systems are overloaded and they often can't cope. This causes an overproduction of gas and thus pain and discomfort. Unfortunately, under these circumstances, feeding more often aggravates the problem. We recommend at least 3 hours between feeds to try and allow adequate digestive times. So many mums of colicky babies are concerned about their bubs because they never seem to be happy and content, and they exhibit this highly pitched scream that suggests pain rather than hunger. Some medical professionals may dispute this, but mums have good intuition when it comes to their discomfort in their babies. Of course, colic is not the only condition that causes pain for babies. So if your baby seems to be in pain, you should always get your babies checked for other medical conditions as well as colic.